Hey guys, I'm Stephanie. I'm a BSN RN, and if you're new to this channel, please don't forget to subscribe, like, and share this video. In this video, I'm going to be talking about things I wish I knew before becoming a step down or PCU nurse. The very first thing on my list is going to be the patient ratio. Yes, the patient ratio. So let's talk about the different units and the patient ratios. The very first, let's talk about the ED or the ER, the emergency room. In the emergency room, typically the nurses there would have 5 patients for one nurse, just because the kind of like the acuity is not that high. But again, be mindful of the fact that in the ED, there is different units in the ED. There's going to be like the less acuity patients, and then there's going to be like the high acuity patients, like patients who come in with strokes, patients who come in with, maybe like profuse bleeding. And then in some other unit or section of the ED, there's going to be patients who are just coming with like pain, who are coming with headaches. So nurses who are typically in this low acuity section of the ED, most of the times they're going to have 5 patients to one nurse. And then patients or nurses who are in the section of the ED that have like, stroke patients, stroke alert, respiratory depression, respiratory failure, kind of like profuse bleeding. Most of the times those nurses are going to have like 4 patients to one nurse. So in the ED, typically it's 5 patients to one nurse. But for the acuity of the patient, sometimes it might be 4 patients to one nurse. Let's move on now to med-surg, medical surgical unit. Most of the times the patients here are kind of like your typical patients who just come because they need to be monitored. They feel like something is off their health, and so they come to the hospital just for like close monitoring. Typically nothing might go wrong. They are just there for them to be watched, and those patients, most of the times, the nurses just continually give them their home medications while just watching their vital signs and seeing that they are at the point where they are stable to be discharged either home or they can go to a nursing facility. Most of the times on medical surgical units, the nurses here would typically have 5 patients to one nurse. But I've seen in some hospitals, just because of the nurse shortages, the nurses sometimes will have 6 patients to one nurse. Let's now move on to the step down unit. The step down unit, or the intermediate care unit, or the progressive care unit is a unit that is one step lower than ICU. Most of the times when you say step down unit, most people will be like, what unit is that? Most people do not know that name or the name of that unit. So most of the times I like to call it step down ICU so that it kind of explains itself. So what is step down ICU? I like to explain it in the sense of step down ICU unit is a unit where patients are critically sick but they are not intubated. Patients are critically sick but they don't have kind of like multiple drips that the nurses have to titrate. Patients are critically sick but they don't need critical monitoring like a typical ICU patient. So for the step down ICU unit, the patient ratio here, the patient nurse ratio here is usually 4 patients to one nurse. But again, in some hospitals, due to the shortage of nurses, there is usually 5 patients to one nurse. Moving on to the ICU unit. The ICU unit, typically everyone knows the ICU unit. The ICU unit is where we have like the critical patients. These are patients who are intubated. These are patients who are on multiple drips. These are patients who are needing constant monitoring, their labs, their vital signs, response to medications, how they are responding to like treatments that are being given to them. So for them, the monitoring like fluids, how are they peeing, how are they ingesting the fluid that is coming out, is it equal to what is going out? So for them, the nurses on this unit typically will have 2 patients to one nurse because they need like back-to-back monitoring. And again, another thing with ICU, why is typically 2 patients to one nurse, is the amount of is the amount of, documentation that the nurses would have for this patient. For the ICU unit, I know that the ICU nurses would document typically every hour or every 2 hours, depending on what aspect they're documenting for the patients. But on the step-down unit, typically we will have like Q4 or every 4 hours. So that's the difference between the step-down and the ICU unit. So speaking of the nurse-patient ratio, another thing I wish I knew was that even though you're going to be having 4 patients for 1 nurse, the stress can be real, the anxiety can be real. In as much as these patients are not intubated, in as much as these patients do not have a high level of acuity in their medical diagnosis, it doesn't suffice to, to look down or not to monitor them critically. So yes, there's going to be stress, there's going to be anxiety. Yeah, you have to keep checking their numbers, because at any given time, things can just swing to the other side. The next thing on the list I wish I knew before becoming a step-down nurse is the acuity of the patient. Yes, I know I just mentioned that the acuity is not as high as the ICU, but be mindful of the fact that most of the times the patients who come to the step-down unit are patients who have been transferred from the ICU unit for us to closely monitor them, but not as closely monitored as in the ICU. And so you should be very, very aware, you should be very, very vigilant to the fact that in as much as they just came back from the ICU, they can still be going back to the ICU same day, next day, same week, but you should be alert. Now, the acuity of the patients, depending on what they came in for, can vary. We have patients who come in with bleeding disorders, we have patients who come in with respiratory issues, we have patients who come in with digestive issues, we have patients who come in with neurological issues, typically stroke, diseases that would affect the nerves, the neurons. We also have patients on dialysis, patients who have endocrine problems, typically diabetic patients. We also have patients who are going to be coming in with alcohol withdrawal. So we also have patients who will be coming in with infection. Typically, you're going to have patients who will be on like multi-drips of antibiotics, for which you also be monitoring their electrolytes. You have to put your eyes on their lab values. You have to critically monitor their vital signs. You have to monitor their, their alertness. Everything is very critical. You should be very alert, because these patients can get into a code, either a code blue, a rapid response, or their lab values can be tanking without you even knowing. So you have to keep your eyes on their lab values. You have to keep monitoring these patients back and forth. Also, the acuity of this patient will also warrant a lot of assessment. The acuity of this patient will warrant you to use your critical thinking so very often. You have to know when to call the doctors. You have to know when to call, your CNA to help you. You have to know when to take the next action. So another thing I wish I knew about the step-down unit was the acuity of these patients. Another thing I wish I knew about becoming a step-down nurse is speaking up for my patient. I'm talking about their vital signs. Maybe the blood pressure is tanking, or maybe the blood pressure is going up. You typically will know that, hey, this patient's blood pressure is kind of looking off. You might want to reach out to the doctor to ask for PRN medications, just in case blood pressure goes up, to give this blood pressure medication. Or if blood pressure is, kind of tanking down, you should give this blood pressure medication. Or let's say the patient's blood sugar is dropping, maybe the patient's neurological signs are changing from what you typically know the patient to be, from their normal or their baseline values. So this is a unit where you would have to very much speak up, whether it is to the CNAs who are helping you, or whether it's to the charge nurse, or whether it's to the doctor. You have to be very proactive. The respiratory therapies, or maybe the physical therapies, or the occupational therapies, you have to know who to call, and you have to know that this is not a unit that you will be shy, because you would be talking to a lot of medical professionals, and you have to be on your A game when it comes to talking to these people. So shyness on this unit is just off the limit. Another thing I wish I knew about the step-down unit is that your phone will keep buzzing like crazy. Your phone will keep buzzing like crazy. I'm talking about phone calls from the patient, phone calls from the patient's family, phone calls from the doctors, maybe the charge nurse, phone calls from the CNA wanting to tell you about a vital signs. People will just be calling you left and right like crazy. I kid you not. Like maybe the patient needs to go for a procedure, they'll be calling you if the patient has signed their form. Maybe they need to sign like the transportation form, or maybe they need to sign like a consent form. Like your phone will just keep buzzing like crazy. So another thing you have to just be aware is that your phone is going to be, it's just going to keep calling and it's just going to keep ringing like crazy. I kid you not, some of these patients can really push you. They will keep calling and they will keep asking, they want to eat this, they want to use the restroom, or they want to be changed. I do understand those are things we have to do for them, but again, be mindful. Yeah, the acuity of the patient, sometimes the families too are going to get to you and they'll keep asking questions. They'll keep wanting you to come in to answer questions. When the doctors are rounding, they'll call you in the room. They'll be like, okay, what are the lab values? How has the patient changed from the beginning of the shift, or did anything significant happen from the previous shift that the nurse told you that they need to know? So those are things that you should be aware that your phone is going to keep buzzing. Next thing I want you to be aware of the step-down unit is that in as much as hospital shifts are meant to be 12-hour shift, I particularly just go to the hospital knowing that it's going to be a 13 shift, because from getting your shift report to passing your medications, doing your assessment, doing your documentation, maybe something that might happen, maybe some significant change in patient's acuity, like things are just going to happen that might push things to, to creep from the 12 hours to 13 hours. Sometimes even it might stay right up to 14 hours, maybe depending on what happens. Let's say in the case of when the patient dies, there's typically some things that you, the nurse, will have to do. You're making those calls, you're making sure the CNA is helping you to clean the patient. And so typically the acuity of the patient, the things you would have to do would normally or sometimes push you to transition from a 12-hour shift to a 13-hour shift. But don't get me wrong, there are days when it is actually 12 hours. There are days when you actually finish in time, which is hardly. You would finish in time, but there are days when it's going to drag into the 13 hours. So be very open-minded that in as much as you are working or you signed for a 12-hour shift, most at times it's going to drag into the 13 hours. So remember that. Thank you so much for watching this video. I hope that this video was educative enough. If you had any questions and you want to ask me, please drop your comments below, drop your questions below. I'm going to do my very best to answer your questions. If there's anything you want me to explain further, if there's anything you want me to throw more light on the step-down unit, please do drop your questions in the comment section and I'm going to make sure I either make a video on it or I'll respond directly to you. Thank you so much for staying right up to the end of this video. I do hope that you're going to like, share and subscribe. And from me to you, stay blessed and I'll see you in my next video. Bye guys.